Asymptomatic COVID-19 patients are of great concern to public health officials and lawmakers due to their ability to spread the virus without knowing they are sick themselves. In new guidance for mathematical modelers and public health officials, the United States Center for Disease Control and Prevention is estimating that about a third of coronavirus infections are asymptomatic. The CDC also says its best estimate is that 0.4% of people who show symptoms and have COVID 19 will die. And the agency estimates that 40% of coronavirus transmission is occurring before people fall sick. The CDC says these values are based on data received by the agency before April 29, and the numbers are subject to change as the pandemic goes into the later months of the year. The numbers are part of 5 planning scenarios that are being used by mathematical modelers throughout the federal government, according to the CDC. 4 of those scenarios represent the lower and upper bounds of disease severity and viral transmissibility. The 5th scenario is the CDC's current best estimate about viral transmission and disease severity in the United States. In that scenario, the agency described its estimate that 0.4% of people who feel sick with COVID 19 will die. For people aged 65 and older, the CDC puts that number at 1.3%. For people 49 and under, the agency estimated that 0.05% of symptomatic people will die. CDC says the scenarios are intended to advance public health preparedness and planning. They are not predictions or estimates of the expected impact of COVID 19. It says the numbers do not reflect the impact of any behavioral changes, social distancing, or other interventions, which would be relevant for some of the agency's estimates, such as how many infections stem from each case. Under the best estimate scenario, the guidance says 3.4% of symptomatic people with COVID 19 will require hospitalization, with that number rising to 7.4% in people 65 and older. The CDC also says it assumes that people without symptoms are just as infectious as those with symptoms. The high number of asymptomatic patients has led to concerns of a so-called second wave of the coronavirus pandemic cropping up later this year. However, some have suggested rolling on and off of lockdowns to deal with the pandemic. As of May 23, more than 5.3 million coronavirus cases have been diagnosed worldwide, more than 1.64 million of which are in the United States, the most impacted country on the planet.